Good afternoon. I am Dr. Sudhir Pillai. I'm a cardiologist at PD Hinduja National Hospital. I welcome you all today afternoon on this discussion on high blood pressure and relevant clinical issues. Now, high blood pressure has been very appropriately named the silent killer uh, of the population because, as the name suggests, it remains silent till it's actually diagnosed. Most of the people do feel that there should be a symptom of the disease before they visit a doctor. But unfortunately, the high blood pressure may not have any symptoms. There are patients, so there are people who do get a little bit of headache, fatigue, breathlessness, or unusual features of high blood pressure. But the only way you can detect high blood pressure is by getting it checked by a doctor. If we look at it, what is the prevalence of blood pressure, how many people are suffering? Though there are no hard data in this country, though there are studies done in some urban areas and probably now in rural areas also as the socio-economic status is improving. The prevalence of blood pressure is almost 30 to 40% of the adult population in the metros of India, which is, if you look at an absolute number, is very high. In the Western data, you may get a prevalence of up to 50 million people in United States of America may be suffering from high blood pressure. And what probably is worrying is if for one high blood pressure, there may be another one who may be undiagnosed. By the time we diagnose in a lot of patients, the complications do set in. The important question from here is what causes high blood pressure? Now, there are different categories. Sometimes we see what we call it as a labile hypertension, which is a response of body to a stress, whether it's emotional, physical stress, uh, while exercising or post-exercise, or you're confronted with a challenging situation in the world. The blood pressure has a tendency to shoot up, which will persist till the stressful situation is there. And once the stress wears off, this blood pressure should come down to normal level. We call it as labile hypertension. You don't have to treat it. You just wait. It settles down in a few days' time. You treat it only if it's at an extremely high level. There's something called as primary hypertension, which is what we see in 98% of hypertensive. When the blood pressure is high and we don't know the reason why it is high. That's why it is called as an essential hypertension, and most of the patients fall into it. What causes it? We don't know. It is whether it is genetic tendency, whether it is intrauterine, an insult to a fetus kidney or a small kidneys, or whether it is because of extremely sensitive body salt intake. The reason is not known. Yes, it's known that even if you have a lifestyle is not good, you have a tendency to worsen your existing blood pressure and probably go into an hypertensive range. There are about 2 to 3% of total hypertensive where we know the cause of high blood pressure, now which may be either deteriorating kidney function or blockages in the kidney supply because of hormonal imbalance, excess or low thyroid or adrenal gland malfunction, diabetes mellitus. Now here we look for a treatable disease, and some of these patients, once we take care of the primary insult, the blood pressure comes down to normal. So this is we come to know only when we investigate them. Now, the important question is what causes the existing pressure to shoot up? What is the role of lifestyle? That is the most important role, is because lifestyle tendency can be reversed, whether it's because of excessive salt intake, whether lack of exercise, sedentary lifestyle, increased body weight, increased body mass index, smoking, excess alcohol intake. These tend to worsen your existing blood pressure. So if you're in a normal or a little higher blood pressure and if your lifestyle is bad, you may go up into a hypertensive range, which means that if you control your lifestyle, you may come down to a normal population and its blood pressure range. So when you first visit a doctor, there are two things which happen. Number one is what we call it as a white coat hypertension. That means an office visit itself it's a stress to a patient or to a person, and the first BP record may not be his base BP. It is just because he's come to the hospital, the blood pressure has been recorded high. We call it as white coat hypertension, and mostly we don't treat them. We advise them to either follow up visit for another check or check at home, the best thing to do is what we call it as an ambulatory BP monitoring, where give a small instrument to the patient, and this is an electronic device. It will keep on recording their blood pressure digitally over 24 hours. So we look at the blood pressure pattern of the person while at work, while at home, while sleeping, whether blood pressure drops in the night. So these things are analyzed before we advise them either treatment, which may be pharmacological or may not be pharmacological. Even if your blood pressure has been recorded in a doctor's office, usually what is advised is to record blood pressure in both the arms and give a 5-minute interval, so that if there is a sudden surge of high blood pressure when you enter the office, it tends to settle down in 5 minutes time. Now, even if you have been diagnosed as a hypertensive, there are times when the blood to shoot up and you need to add more drugs. We call it as an accelerated phase of hypertension. Sometimes it goes in extremely high blood pressure with damage to the organ. We call them as malignant phase of hypertension. Now, what causes this accelerated phase? Number one is sometimes there are external or internal insults. Now, if there are some hormonal imbalance in the body, if there are blockages in the kidney circulation which have come up, if there are diabetes has started or the thyroid has gone abnormal, then the blood pressure does tend to go up. But there are some medications, some external influence also. Now, the commonest reason we see the blood pressure going up in some patient is that taking drugs, something like a painkiller. Now, except paracetamol, other drugs, most of them have a tendency to make the person a little bloated and cause the blood pressure to go up. There is also some reasons like excess salt intake or a binge on alcohol. Then they make your blood pressure to go up than their baseline level. Why we worry so much about blood pressure? Because it comes with complications, and complications take time. And there are a lot of patients in which the first time we detect blood pressure only when they visit the hospital with complications. Now, these complications can involve the whole body. Now, there are patients who come with a stroke or a hemorrhage or a bleeding in the brain, heart attacks, heart failure, kidney failure, the rupture of the aorta, that is the main blood supply or the pipe of the body, which is devastating, and also blockages in the blood circulation of the legs. Now, once the complications set in, then you are catching up. You're catching up to reverse the complications, which it's probably not possible because this has set in over a period of years. So the benefits of controlling blood pressure today is reversing or chances or reducing your risk of develop heart disease by 20 to 40% over a period of 20 years. Reducing the risk of a stroke by about 20 to 30%, reduce the risk of kidney failure by 50 to 60%. So the treatment today is potentially to reduce the development of complications by the time by 15 to 20 years. Now, what can we do when we have a little bit of when hypertension is detected on the first phase or in the first visit? Now, as I said, once the blood pressure comes up, we tend to categorize patient on different categories depending upon the severity of blood pressure. A lot of patients or youngsters do fall in what we call it as prehypertensive. Means a normal person should have a recording upper value less than 120, lower value less than 80. So if you are between 120 and 40 upper value and lower value between 80 to 89, we call them as prehypertensive. Now, this is a population which has a tendency to high blood pressure, which may not be treated with medications. We just have to take care of the lifestyle and try it without drugs. Then there are stage 1, where upper value is 140 to 160. Stage 2 is more than 160. Same thing, lower value moves between 90 to 100, 100 to more than 100. Then comes the most important aspect. What lifestyle modifications? What can be done to control the blood pressure or reduce the blood pressure in somebody who may not need a drug? Number one. And number two, even if somebody needs 2 or 3 drugs for blood pressure, if we try to control the lifestyle, we may reduce the number of drugs we take. Lifestyle modifications are very basic. Number one is loss of weight. Now, with every 10 kilo of loss, your blood pressure, the upper value, you can reduce it by about 10 to 15 millimeter mercury, which is about 5 to 8%. Quitting smoking, moderating your alcohol intake will reduce blood pressure by another 5 to 10%. Cutting to your salt intake to less than about 1.5 to 2 grams a day will bring your blood pressure down by another 5 to 8%. Exercise will bring it down by another 10%. So you can control a lot of blood pressure in the model or borderline blood pressure patients by just simplifying their diet, advising them exercise or de-stressing them, loss of weight, cutting down on salt, increase the calcium intake, a little bit of potassium supplementation will go a long way in controlling the potential complications. So if you are a pre-hypertensive today, you cannot sit and say that fine, my blood pressure is 130 by 88 and I'm good, I don't have to do anything. It's probably that whole idea is being given up. Anything more than 120, anything more than or value more than 80, you better gear up and take care of things. Take care of your lifestyle so that you prevent your complications which may set in after 20 years. Thank you very much for your kind attention. We are open to questions from here on.